I will talk on HIV in Turkey. As you see, I'm a staff of the gastroenterology department. I'm not an infectious disease person. I actually don't know much about HIV and also not much about HIV in Turkey. So having said that, I looked a little bit around. I have to say, I mentioned change of overall change in general, and I mentioned that change occurs in a faster pace than we think. And I want to give you an example. I spent 2 years in the US between 91 and 93, and I saw a lot of HIV/AIDS patients, actually, patients with AIDS. In those days, AIDS was not treatable, and I thought I could use this experience back in my country. So when I was back in my country, I realized that at the University of Ankara Medical School, at the infectious disease department, not a single case of HIV was followed. And a professor who lent me a few slides from Hacettepe University of Ankara, another university medical school, they were following such cases, told me something which may be black humor or a joke, but has also some reality. So he receives a phone call from an infectious disease professor from the University of Ankara Medical School. Hi, how are you? How are things? Everything's fine. And after a few phrases like this, the next thing is, oh, by the way, I have a patient with HIV. Can I send this patient to you? So that was the case. And you will see how things have changed, because now we are also following, this same professor also follows patients with HIV at the University of Ankara Medical School. So let me start. History of HIV in Turkey. First case was diagnosed in 85. In 86, 87, we started screening for HIV in blood products, and coding of the patients' names were found to be necessary in 94, and reimbursement of antiretroviral therapy started in 96. Now, this is a study not published in 2013, but 2014 in the Lancet, and it is an overall estimate of incidence, prevalence, mortality in several infectious diseases, including HIV. And this is an effort of the United Nations, the so-called UN-AIDS approach, which goes through the literature, studies prevalence and incidence rates, published data, and come up with estimates. And if you look here to Turkey, I'm sorry, okay, go back. Now, is there a pointer? Oh yeah, okay. If you look to Turkey here, and you can look also here, you can see that that's per 100,000 population is less than 0.2. This is the lowest you can get, and that is for Turkey, HIV. So in Turkey, HIV is absolutely not important, similar to Czechoslovakia before communism, in communist area. After communism, we know HIV started to increase. So we need communism again. And this is the age standardized prevalence of HIV. Again, the lowest you can get is less than 9.2, and this is also the case in Turkey. And I will, one advertisement about my talk, I will give you one of the most interesting slides of the epidemiology data session here. Next slide is incidence, and incidence refers to new cases actually. Again, Turkey, but it's no more this dark blue color. So we are not in the least significant disease burden anymore, but we have jumped up a ladder. So Turkey has an incidence per 100,000 of 0.2 to 1.8 and not less than 0.7. What is the reason for that? And this is the striking slide I want to show you. New HIV diagnosis in Turkey as of December 2014. Now, the previous speaker has shown the cumulative case burden of HIV in Turkey. This is something else. But this is new HIV diagnosis in Turkey. Look at in the 80s, we were a very moral country, and look here, it goes up. Terrible. And this is a rise in an exponential shape. Total number of HIV testing performed also rises more or less in a linear fashion. Gender, the majority are male. Routes of transmission, again, interesting. Heterosexual intercourse accounts to probably 1/3 of patients. Homosexual, 15%. Nosocomial, less than 1%. Vertical transmission, less than 1%. IV drug use, less than 1%. What do we have here? Unknown. How much? 51%. So I don't know what that means, but I can imagine what that means. And Turkey is a 98% Muslim country. We are quite conservative, so there must be something hidden here. HIV cases according to nationality in Turkey, 85% are Turkish. And in terms of HIV testing, in blood organ tissue donation, it's obligatory. In registered sexual workers, it's obligatory. In the rest, before marriage testing before medical intervention, it's not obligatory. In my talk, I will not mention HBV-HCV prevalence, but just to give you an estimate. According to a recent nationwide epidemiologic study which used cluster sampling methodology, which was sponsored by drug companies, the biggest study ever done, showed that Turkey has a HBV prevalence of 4%, HCV of 1%. So this is for the general picture. Now, in terms of the age, this is a study which has been submitted for publication from Hacettepe University, so it's a tertiary referral center, which may not represent the whole thing, but still it gives you some clues. So the majority of patients are diagnosed in their 4th decade, 1/3, then 1/4 in their 3rd decade, and again 1/5 to 1/4 in their 5th decade. Transmission route, again, according to the same study, heterosexual intercourse, 70%, men who have sex with men, 15%, and the rest is negligible. Now, another important point is, what is the reason for HIV testing? Now, this, I will show you other data, is maybe specific for this tertiary center, where it shows that clinical symptoms or to have a HIV positive relative or partner accounted for the majority of cases. Now, as I said, I will show you another slide, but not in sequence. What about HIV-HCV coinfection? This is a study from 5 centers which represent the Action Against HIV study group from Istanbul. This also shows a paradigm change in how to approach patients with HIV. So they came up with 950 HIV positive cases. And in these cases, route of transmission was reported to be heterosexual intercourse in 50% almost. Men who have sex with men, 30%. IV drug use 0.9%. And prevalence of HIV-HCV infection, again, 0.9%. So IV drug use, according to several studies, appears to be really negligible in Turkey. Therefore, co-infection with HCV-HBV, again, is negligible in Turkey. Genotypes 1b was seen in 5, 2a, 2c in 1, 3 had genotype 2, not determined in 1. Now, demographic characteristics of patients according to hepatitis C virus seropositivity, the same study. So there were 9 patients with HIV-HCV co-infection compared to 940 without HCV. And what comes up is that IV drug use was a significant factor for HCV co-infection. Although very rare, still that accounted for the HCV positive cases. And then the numbers are very small, but 1 out of 9 makes still 11%, and 10 out of 940 is only 1%. So imprisonment was another factor determining HIV-HCV co-infection. Now, a few slides lent from the professor I mentioned from Hacettepe University. They have a cohort of 255 patients with HIV, and HCV co-infection was found in only 7 patients, 7 out of 228 where this was tested, so it's 3%. And genotypes of these 5 patients were as shown here. HBV-HIV co-infection was seen in only 1.7%. So this is a country which has a higher HBV prevalence, but still HBV-HIV co-infection appears to be not a problem. Now, reasons for HIV testing. Again, the same issue once again, but this is now a big cohort, a multi-center study of 24 sites, the HIV-TR cohort, 693 patients diagnosed in the period of 2011-2012. Reasons documented in 640 patients. Transmission routes were 63% heterosexual and 23% men who have sex with men. And reasons for testing in this cohort was in almost 50% diagnostic workout for other medical conditions, and then patients initiated in 15%. Now, diagnosis and treatment of HIV in Turkey, again, the same HIV-TR cohort, 693 patients, the same patient group. Proportion of patients presenting late, and by late it is CD4 cell count of less than 350 per millimeter cube, or to have an AIDS-defining event, was seen in 82%. 30% of the whole population had even a CD4 count of less than 200. Despite this, only 1.6% died, and more or less the majority could be rescued by therapy. Because HIV RNA was negative, or less than 50 copies per ml, in 82% after 48 weeks. Based on these data, they concluded that a national HIV testing strategy targeting subpopulations with higher risk is urgently needed. Now, one word about HIV genotypes in Turkey. Based on several studies, the majority of HIV genotype, as you can see, belong to genotype B, 30 to 40%, followed by circulating recombinant forms, and then by genotype A. So in summary and conclusions, HIV continues to be infrequent in Turkey, but in contrast to global trends, the global trends show a progressive decline of HIV diagnosis and incidence, but in Turkey, this incidence is increasing significantly, as I have shown you. The main reason appears to be a homosexual intercourse between men. IV drug use has definitely a negligible role. An important problem is late diagnosis. Treatment in Turkey is totally reimbursed, and effective therapy rescues vast majority of patients, but more effective screening in targeted populations are probably needed. Thank you, and if you have any questions regarding HBV, HCV, please feel free to ask me.